Hello, this is the Nigerian Symposium for Young and Emerging Leaders on Rubbin Minds. My name is Shea Olo and I'll be your host. We will be asking questions on our panel today to our two specialists that are in the house today as regards the healthcare sector in the country. You know, this is a special time and I believe special times breed special innovation. Also, this is the time for many people to become innovative. As regards the COVID-19 pandemic that has struck our nation, what did it do? Did it reveal our shortcomings, or has it given us a chance to step up our game on this particular order? Today with me in our panel, we have two specialists that will be speaking about it. So feel free to ask questions as time goes on.
The Nigerian health sector has shown adequate response to COVID-19, and in the process, many of its flaws which many knew internally were revealed to all externally. How do we ensure that the learnings from the impact of a global pandemic are factored in when it comes to policy formulation and implementation for the health interest of the average Nigerian citizen? What can be done to correct the subdued state of the Nigerian health sector? The Secretary General of the Nigerian Medical Association, Dr. Philip Ekpe, and Toby Wojuola, these questions and more up next on Rubbin Minds.
Welcome to the show.
Thank you.
So, as we all know, we are in this pandemic right now. But before that, we had a healthcare system that was supposed to be functioning. With this COVID-19, I would think that it revealed our shortcomings as well as spaces that we could improve on. Doctor, please, would you shed some light on your own perspective of things as regards the healthcare sector?
All right, thank you very much. First of all, we must have something behind our mind when we're talking about these issues of healthcare system. Who are we as Nigerians? Nigeria is a developing country when you compare to the Western world. So you expect that just as it is in every other system, but the healthcare system is developing. So you won't be able to be comparing with maybe already developed countries vis-a-vis UK, US, Italy, France, and the rest of them. Rather, I'd be comparing maybe with countries like India, countries like Ghana, and maybe some other countries, not even South Africa. We must say the truth. I mean, before then, we wouldn't have said that we were so impressed with our healthcare system. But then, it was an evolving scenario, where Nigeria is growing. We have got a myriad of problems, politically and otherwise, corruption issues, which the president of the country is also trying to tackle. Just like every other system have not fared so well, so also is attributable to health. But then, I'm not going to sit down here and say we are stagnant. One thing you must point out is the Nigerian human resources in health is very robust and very wonderful. We've got a whole lot of intelligent and wonderful professionals in this country. That all we needed is more of support from the system. But I must tell you something, that there is no country that can afford the healthcare system. No government can afford the total healthcare system of its country. That is why you need to also involve the private sector. Nigeria, for instance, about 70% of the citizens of this country is being catered for by the private healthcare sector before the public health sector. So how are we doing with the public sector? How are we doing with the private sector is very, very important. I wouldn't say that we are abysmal, but I would rather say that we have not fared so well before COVID-19, but we think we're doing well. However, maybe that may be the next anticipatory, maybe the next question you're going to ask, that how has COVID-19 affected the healthcare system? Of course, it brought out the weakness, but you must also accept that it also brought out the weakness of healthcare system in the United States, even when we term it a developed country. This is because first, COVID-19 is a novel virus. Nobody knows about it before now. So how to tackle it was also not known. And I'm sure you're aware that the last pandemic was around 1918. That was some more or less about a century or more, And so we didn't even think that in our lifetime we're going to come and face it. So it's a new disease that, where we were 3 months ago is not where we are now. Yes, it revealed our weak health system in the country vis-a-vis facilities, infrastructure, not human resources, However, the Nigerian government, the healthcare workers, and the Nigerian people, to some extent, are ready to tackle it. You can see that the Presidential Task Force is doing a great work, meeting every day to see how to resolve the problems. NCDC is doing their own part. The Federal Ministry of Health is doing their own part. All the healthcare workers and their unions, associations are also doing their own part. We also need the Nigerian people, you, I, every other person here, to also do their own part. That is the only way it's going to work. Together, we can be able to maybe deal with this virus. Thank you.
So, Doctor, just 1 second, Mr. Toby, before we get to you. People would say the major, or what would you say is the major problem, the core problem of the Nigerian healthcare system? Is it financial or the human resource aspect of it? Because according to numbers, we have about 72,000 doctors, but it's approximately half of them, about 32,000, are currently active. And a whole lot of them are vying to go overseas. So what would you say is...
Well, thank you very much. First of all, some years back, the African leaders met and agreed that at least the healthcare budget should be 15%. I will tell you that the highest that has happened is 6%. That, on its own, has reduced the healthcare system. Nigeria is also a system where the healthcare insurance is not functioning very well. We are head of NHIS. I'm telling you, up to today, NHIS has not covered beyond 10% of the Nigerian population. And that is because they're able to have the privilege of covering the formal sector. How about the informal sector? I mean, in a good society, the citizens shouldn't be paying from their pocket to access health, because health is a basic need of every citizen of a country. No, so it's a system problem, in the sense that we don't have enough facilities. In this country, I don't think there is any hospital that has up to 2,000 bedded hospital, compared to what you see in India, in other countries, some 5,000, 10,000. What about, the very high fallopian hospitals where you have strong referrals? They're not there. Even if they're there, they're poorly equipped. So it's time, for the federal government to do its own part by partnering with both the private sector and the public sector to upgrade the facilities such that we'll be able to compete favorably with other countries in the world. Now, you are looking at human resources. In terms of the intellect, in terms of ability, in terms of competence, we are not lacking. But now, I'm telling you that even in the midst of COVID-19, we still have a lot of doctors roaming the streets of Nigeria without job. So how do you expect them not to leave the country when Saudi Arabia, where UK, where US is offering them jobs? I think that is part of the problem we must look at. It's not because they just want to leave. It's because we are not offering them jobs. I know so many that they want to remain in this country and work. How about even the healthcare system? Now, the other day you heard that doctors are going on strike, NAD is going on strike. It's not just because of money. It's because of lack of other things, other factors. Residency Training Act, residency training funding, facilities in the hospital. We all watch television, even for those who are not opportune to travel out. And you can see the difference is clear. In this age of IT with internet, you can see what is going on in other countries. I think it's time that we need to up our game, not just in healthcare system, but everywhere. Education, technology, all and all. COVID-19 has come as a leveler. You can see nobody can travel out. It doesn't respect whether you're old, whether you're young, whether you're rich or whether you're poor. It just comes at you. So it's time we all have to stay here and salvage it. Thank you.
Yeah. So, Mr. Toby, adding to that, as regards the 2020 budget, it states about 4.14% of that budget was allocated to the healthcare sector. And with the question asked, the flaws, were they financial or human resource-wise? What is your take on this?
I think it's largely the like Dr. rightly said, the pandemic itself has startled every country. It has revealed the fragility of every system, whether, like you said, seemingly developed. we're reading tales of the U.S. health system in jeopardy. We're reading tales of the British health system in chaos, of their NHIS or NHS officials telling people to preferably just stay home and treat yourself. It doesn't mean that we are better, but it shows that we have some bit of a potential to do much more than even other countries. Nigeria is a blessed country, and rightly said, our human resources potential are limitless. Over the world, the reason why our healthcare experts are sourced and are like hot cake is simply because we produce some of the best brains, some of the best characters, people who go through a system that is not all the best in terms of facilities, but still come out with sophisticated ideas and are able to solve some of the world's challenges. Across the world, in America and what have you, and around the world, Australia, Britain, Nigerian medical doctors are all found there. But then you now bring it back to the Nigerian situation. I think historically, we have not created an enabling environment to tap into the abundant human resources we have in our medical systems. And this goes beyond financing. Because financing, like he said, it's not just even a government thing. We need to have private investment. You don't expect the federal government to be the one establishing hospitals in every nook and cranny of the country. But have we provided as a government, and I'm talking not just this government, but historically, have we provided the enabling environment financially for business, for those who are looking like an American system, for instance, is a system where health is a business. It's not looked at as a social need. It's looked at as how much can it be, how much can you make, and that's why you have the insurance and all those guys trying to profit off the system, and also the pharmaceuticals as well. We need to have a system in Nigeria where there is a balance between the private, the public. Of course, the private sector will be looking to profit. The public sector, that is government, looking to ensure that social good is achieved. We need to have a coming together of these two. And I think the COVID situation has shown that this partnership can happen and can work. A lot of the donations that we have seen have come from private sector. The banks, the multi-billionaires making donations. We need to also see more investments in the private sector, which I'm referring to. Putting investments in healthcare. When I read stories of hospitals like Aminu Kano Teaching Hospital or the University of Abuja Hospital in Gwagwalada performing surgeries that were perhaps a decade ago thought to be only foreign or alien, but they're doing it. It shows that we have the potentials. If we can expand on this, invest on it, we are going to have a situation where Nigeria can cater for the health needs of African countries. That potential is there.
That being said, the fight against COVID, there can be various approaches, if you would agree with me. Apart from just the financial aspect that goes to where you need to pay for research and pay doctors and researchers, why isn't there a campaign that is educating Nigerians as regards the things they can do in advance? I know, yes, there's the mask wearing, hand sanitizing, but a campaign that drives a much more dietary message that tells them, okay, eat in this direction at the least to help in this direction. Because a number of people just believe they just need to take an injection, or they need to, but like you said, asymptomatic, if I'm pronouncing it right, you don't get to show off, you don't get to showcase the symptoms. So why isn't that the government are trying to, at least, because they can't get out the cure to everybody if a cure does come to light. So why not pass out a message as regards their diets? And also, in Nigeria, we are known for some of our local remedies. Why can't the government also invest into the production of local remedies?
I know there is 100 billion that is marked out,
100 billion,
you know, for anything related to health, including pharmaceuticals, you know, which the health people should assess, you know. Now, it's one thing to make that announcement. It's one thing for that finance to be available. It's one thing to judiciously disburse that fund. It is that judicial disbursement that will become a problem. Government have shown
the due process for the application of the funds.
Exactly, you know. So that is that. Just so to synchronize with my friend, yes, there was an announcement by there is a Catholic place in Ewu in Edo State that talking about a drug, Pabax or whatever. But and they claimed that NAFDAC has approved it, but NAFDAC has also come up with a disclaimer. You know, we got to be careful because of also the Madagascar issue, where, you know, we already agreed here that COVID-19 is a novel virus, and so we don't just want to jump into anything. NAFDAC can approve your research work. Go ahead and research. Okay, use it, ethical issues. But it's okay, we've approved that this drug should be used all over the country. I mean, those are areas that they have to look at, you know. We were talking about agriculture. Yes, it's good to eat good food, but the point now is that we have a problem to solve right now. You understand? You know, we must all agree that Nigeria is a poor economic country. Our budget, the whole country's budget, is not as good as California. But where I want to differ with you, we're talking about percentage. You know, percentage of the, yes, what I'm trying to say. Even if it is 100 billion, let it be as maybe up to 15%, 15 billion. If it is 1 trillion, then the 15% of it, or 10%, what I'm trying to say is 6%. That, you know, so that has been the problem. He has already mentioned, you know, but another thing I would look at is, even if we look at health as an investment, no, we also have to look at it that it is the right of every citizen of this country. And that is why we are appealing to the President of the Federal Republic of Nigeria to approve for mandatory health insurance for every Nigerian.
With the points you've hit on, I will be hoping that we'll have a means of approach moving forward from here on out, because these are the things that our leaders need to hear and need to understand. Yes. I know that you're with the presidential media team, so... But
I've clarified the issue. I know it's been trending that 58 Nigerian doctors were stopped from traveling out because they are trying to maybe leave the country in the midst of COVID. The question I've just told you to look at is, have we employed all the ones we have in this country? We have so many of them that do not have a job. And they're asking you, in short, this period of COVID-19 is a period where you open up the job for healthcare system. Everybody that is a healthcare worker, you understand, because we need them, should come into the system, even if you're going to pay them less. But the problem is that as of this moment, we still have...
Let me just piggyback on that. We must, going forward, not see healthcare as a one-man business, yes, as the business of just the government. At this point in time, there are people who are investing in cement factories and what have you, or rice factories. Let them also think health. We must think health not just as something that we should leave for the government entirely. Yeah. It should be something
you did mention that the COVID did bring about a synergy between the government and private sector
absolutely,
as well.
Absolutely.
So I'll be guessing, or I'll say that based off that, there are private individuals that have already began
and they should
to divert part of their organizations into the direction of healthcare.
Absolutely.
And the funds from those organizations, so that people can find available healthcare and affordable ones at the same time, if I'm not mistaken.
But we have a fear. We have a fear. Should COVID disappear, are we still going to sustain this drive? It would be a shame. It would be a shame that COVID disappear and we go back to where we were without taking advantage of the exposure of this weak healthcare system.
Well,
we have to mention it here so that those who are listening to us will listen to us, that who are watching. It's not an issue of just response because there's COVID. It's an issue of saying
sustainability.
Sustainability. What are the weak systems that we found?
Well, I would believe that they will see it as a foundation for things to be built off on. The COVID is a testing to our foundation and is left to us to repair and adjust every single thing that needs to be done, if you would agree with me on that. Because that's the only way we'll be able to move forward. Fantastic. And with that, we come to an end of this particular segment, the healthcare segment as regards the COVID-19 and the healthcare sector in Nigeria. Hopefully, our leaders will listen to the great words that have been said today, the words of wisdom and knowledge, and attack this situation head on. Because without good health, I don't see how the future is bright.
Absolutely.
And we'll be coming right back with another segment on Rubbin Minds. Please stay tuned, stay blessed.